I'm Joe Agustinelli, Social Media Manager at Greenway Health, and welcome to our next episode of our podcast, Putting Possibility into Practice. What regulatory concerns you should be primarily concerned with about for your practice? And David, as we approach the March 31st date and wrap up this first quarter, what should providers be doing at this time?
So right now, the provider community should be really focused on three big things. For starters, we have March 31st as the reporting deadline for MIPS from last year. So really important to go ahead and go to qpp.cms.gov. Make sure you register and sign in. The portal is actually a little bit different from what you're used to in the past. So now it'll actually show you live scores as you upload your QRDA files or quality reporting files and the test for ACI and improvement activities. But really important to go ahead and do that. Make sure you feel like your data is coming out and that it's validated and really clean. Make sure there are no reporting issues within your systems. And again, just make sure you get this off to the government by March 31, and then that will be done at qpp.cms.gov. Another reporting deadline to keep in the back of our minds is February 28th, Medicaid Meaningful Use. That was done through your state's Medicaid reporting portal. And then I would also say the other thing to keep in mind right now is that people should really be getting ready for 2018 and have a plan in place to implement that. So 2018 has a higher performance threshold. It goes from 3 to 15. There are different ways you can meet this threshold. You could do, say, the required ACI measures plus 1 CQM, or you could do 6 CQMs. But you want to make sure you have your plan in place sooner than later, especially because quality is full year reporting, whereas improvement activities in ACI are 90 days. And we're already, about 2-3 months into 2018.
So as March 31st comes and goes and we get to April 1st, what do providers need to keep in mind now as the next quarter begins come April 1st? Any specific things they should be doing?
Sure. So first thing I would say is make sure that you have fully mapped out your 2018 plan. And make sure you're following those workflows and adhering to them. But the other thing that's going to happen in the April-May timeframe is the proposed regulation for 2019 is going to come out. And frequently what we'll see is a proposed regulation come out April or May, and then it's finalized November 1, and then it's implemented by January 1. So that doesn't leave a lot of lead time from finalization to implementation to prepare. So it's really important to get your head around it while it's proposed. In 2019, we're going to see two things come out. We're going to see mean and median scoring introduced for MIPS, and we're also going to see in 2019, cost go up to 30% of all score of your MIPS composite score. So really important to keep an eye out for that. Also keep an eye out for how they're going to measure costs. They're going to introduce episode-based measures in this rule in all likelihood, but they will be new measures that we have not really seen before. So really important to get your heads around that in 2019 when that proposed regulation comes out.
So as we go towards 2019, and obviously this early in the year, it's so hard to tell, what's going to happen going into 2019. But is there anything that a provider or a physician can do now to prepare for 2019, or is it kind of a wait-and-see approach and then reactive more than proactive?
So you can really take a look at your prior year's performance data and through your quality resource and use reports, and that'll give you an idea of how you've done quality measures in the past. You can also take a look at your Medicare spending per beneficiary, so you can start proactively thinking about ways you can possibly intervene in patients' care and help bring down the total spend in the system. But it's really about reviewing your prior year's performance and identifying those gaps, which is something that you can really do for every year. It's just in 2019, the requirements become more stringent.
And how do providers, outside of conferring with you, how do providers and physicians stay on top of the changes, in legislation and in regulatory compliance, so they make sure that their practice is in coherence with whatever is handed down?
So I always recommend subscribing to certain listservs. At Greenway Health, we certainly maintain a fairly active library of these materials for your consumption. To get it straight from the horse's mouth, though, go to qpp.cms.gov and subscribe for updates. So CMS frequently updates this program, produces a lot of really digestible material in terms of webinars, different blog posts. Every 1,000-page rule comes with a fairly decent 30-page executive summary. That is a really great starting point. So really start with subscribing for updates to MACRA. And also, like I said, you can rely on our materials as well to give you further guidance.
And what kind of, I know it's hard to really forecast what's going to happen in 2018, but, as new leadership in D.C. and new leadership at HHS, comes on board, is there some type of perhaps direction they may be leaning in? What have you seen and heard so far?
So this is all based on some speculation because we have a new Secretary of Health and Human Services, Secretary Azar. I would expect in terms of directional change for Azar to be much more pro-value-based reimbursement than we saw with Secretary Tom Price, who came from a physician background, right? He was a former orthopedic surgeon and was perceived as relatively want to give providers more flexibility. I suspect with Secretary Azar, some of that will go away and these rules may become more stringent.
Thank you for listening to this episode of Putting Possibility into Practice, the podcast of Greenway Health. If you haven't done so already, I invite you to take the time to subscribe to our podcast so that you will get updated as we provide new episodes to help you and your team expand possibilities in care. Once again, I'm Joe Augustinelli, Social Media Manager at Greenway Health. Thanks for listening.